Let's bring in health activist and president of the Association of Medical Council of Africa, Dr. Kgosi Letlape. Very good afternoon to Dr. Letlape. It's always a pleasure to see you. Thanks for being with us.
Good afternoon to you and the viewers.
Doctor, you know, South Africa's vaccine rollout is sort of picking up speed, and of course we saw this week the 18+ group also now being eligible. But, you know, on the back of that and in the midst of this all, people are also campaigning against COVID-19 vaccines. I mean, how does this all sort of balance out, and how do these voices affect those who would have been hesitant to begin with?
I think we've created a challenge as the medical profession where we have not created safe spaces for discourse.
Yeah.
Where people can express their opinions. If you look in the legal system, they will accommodate minority opinions without those being chastised or being ostracized. But you'd still come to a point in terms of the consensus viewpoint and what needs to be done. So because we don't have those spaces, you end up with those areas of discourse occurring in the public environment. And we need to ensure that we go back to our medical values, where discussions occur in the right forum, where people can express different views. It can be discussed with peers. We can then come up with common guidelines and a common communication to the public.
Doctor, I mean, how do you begin to create those safe spaces for discourse? And I'm glad you said that. Basically because of the fact that, you know, these conversations, and, you know, you hear some of these people who have now been labeled anti-vaxxers raising some concerns and immediately being shut down. Why not open the conversation and address some of their concerns? Some of those concerns might, in fact, be valid, instead of having a situation where, you know, there's name calling, there's all of that. Why are we not opening those safe spaces for discourse, as you put it? And where do we begin to do so, since you've also raised it?
I think one of the unfortunate things about COVID, and it's an international problem, not just in South Africa, is that COVID has been politicized and COVID has been taken over by commercial interests. So the normal processes of looking at new modalities of treatment have been bypassed. I accept the fact that this is an emergency and there's emergency use authorization of vaccines, but we should not bypass the normal mechanisms. In my opinion, what should happen in South Africa, for example, the NICD and SAPRA should be in the forefront of what gets communicated. From the political side, they should confine themselves to issues that pertain to decisions that need to be taken based on the recommendations of the health fraternity. If we recommend lockdown, we cannot pronounce on that. It would be the political authorities that make that step. When we go out to the public and we talk about health issues, let it be the healthcare professionals, whether they are the ones that are in the Department of Health or in state institutions or in independent institutions that, like the National Institute of Communicable Diseases, let those people come forward so that they should take responsibility for what is being said.
Yeah.
The other issue is that we need to ensure that we do not sanitize information. What do I mean by that?
Yeah.
If a vaccine is 99% effective, we have a duty to talk about the 1%. So that people make informed decisions.
Yeah.
I've been a surgeon all my life. And as an ophthalmologist, the patients that I do under general anesthetic, there's a risk of death. And in 31, 32 years, we've been fortunate not to have a death. But with every patient that I've got to take to theater, I explain to them that negligible risk so that they are making an informed consent. We should go back to our basic medical values, where our ethics prevail, where we give information, not sanitized, so that people can make informed decisions.
Yeah.
Whatever the risk is, it needs to be put out there and quantified so people can make informed decisions. And we also need to, you talk about people that are called anti-vaxxers, people that have been in the profession, people that are dedicated to the service of mankind.
Yeah.
We need to change that language. We also need to change the language where when a person chooses not to have a vaccine, they should be labeled as electing not to have a vaccine, not as refusing. They should be taken as making a choice. Yeah. I mean, I concur with promotion of vaccines, but we should be frank and honest, and the appropriate people with the appropriate authority and training have to speak on matters that pertain to their field.
Yeah. Now, as we see gatherings and, overcrowded protests starting to pick up every other day, the question again comes to whether or not we're likely to see, a fourth wave of infections expected in December. And those who, of course, are taking the vaccine are saying, look, let's try to get us to the herd immunity so that we can indeed by December be able to avert this issue of the fourth wave. Where are you on this issue when it comes to what's we're being told that there is going to be a fourth wave in December on the back of the issue of the vaccination drive in terms of where we are and where we're going?
I think a group of scientists in South Africa have spoken on the issue of herd immunity, that it is something that we should not bank on. We promote vaccines because of the protection they provide at a personal level, because they reduce the risk of severe disease, they reduce the risk of dying, they reduce the risk of being admitted to hospital or getting into ICU. They do not eliminate those risks, but they greatly reduce them. So protection would be at an individual level. So we should not be thinking herd immunity. So for protection of individuals, which is how we practice medicine, the more people that are vaccinated, the better for the people. But also we should not bury our heads in the sand. And because we do not have resources and we lag behind other countries, we should learn from what is happening in other jurisdictions. Israel had vaccinated more than 70% of the population. So they reached the target that had been set for herd immunity. They are now in the middle of a fourth wave, with vaccinated people also becoming affected by COVID-19.
Yeah.
So we all need to understand that it's the virus that dictates what happens. And as the virus keeps mutating, we should hope that it mutates to self-limit its pathogenicity on us. And we must all act responsibly. So the issue of non-pharmaceutical methods is here to stay. And we should stick to washing our hands, masking, and distancing. We should avoid gatherings. Those things become critical in curbing the spread of the virus. We should not forget that in the first wave and the second wave, there were no vaccines, but we were able to contain the spread of the virus using non-pharmaceutical methods. So those should not be abandoned. We've seen what happens in societies where they say, we vaccinated, people don't have to mask. And you see a resurgence of COVID. And the issue is, we should understand that we are in this together.
Yeah. In
South Africa, we cannot introduce vaccine imperialism, where people that are vaccinated think they are higher than the others.
Yeah.
I mean, our vaccine rate is less than 20% of the population. So people that are vaccinated should be humble, and we should be working together. We shouldn't divide ourselves into a population that is not vaccinated and a population that is vaccinated. We are in this thing together. And as long as we hold our hands, we don't lose our humanity, and we respect one another, we will overcome.
All right. I think that's the perfect place to leave it. Doc, it's always a pleasure to be with you. Thank you very much for joining us here on SABC News and availing yourself as always.
Thank you very much, and thank you for the opportunity.